Hello, this is State Senator Glenn Gruenhagen coming to you again from the Minnesota Capitol, and this is part 2 of a series on healthcare in crisis. Last video, which you can find on the internet, I showed you a diagram from the federal government of Obamacare, which I call Abomination Care. It basically shows the patient here on your left and the doctor over here on the right. And in order to get to see the doctor, you have to go through this bureaucracy. This has led to a huge bureaucracy in the state of Minnesota, both in insurance companies and in healthcare. Of course, hospitals and doctors have to create a huge bureaucracy to deal with the bureaucracy. So one of the reasons your premiums skyrocketed and your deductible skyrocketed under Abomination Care is because of this paying for this huge bureaucracy and to micromanage the doctor-patient relationship. The result is you have narrowing networks, and you have a more difficult time to have access to see your doctor. The other consequence, a few years ago, the Star Tribune did a study on doctors, how many of them were thinking of retiring or were burnt out. And in that article, they showed in Minnesota, over 50% of the doctors were burnt out on this bureaucracy and were considering leaving healthcare or retiring early. There's actually a study here in Minnesota that shows that by 2030, we have a projected shortfall of over 2,260 doctors in the state of Minnesota. Think about that. So if you think your access is difficult now for healthcare, you haven't seen anything yet in the next few years. And we continue to bloat the bureaucracy rather than the doctor-patient relationship and allowing patients to seek the health care they need. Again, I have a bill I'm working on that would circumvent most of this bureaucracy and give you better access to health care. Hopefully, I'll get a vote on it this upcoming session here in the state of Minnesota. It would be an option that would be available. Second thing, I want to show you how single-payer or government-run healthcare is going to be a disaster, which is what the Democrats and Governor Walz are advocating. You know, a few years ago, we passed a price transparency list here in the state of Minnesota. And what it did, all your clinics are supposed to abide by it, although I checked my local clinic and it wasn't being abided by at the time. They're supposed to list the top 25 services that they provide of $25 or more, and they list the reimbursement rate for medical assistance, Medicare, and then private insurance. And what you have to understand is doctors and hospitals lose money on medical assistance, Minnesota Care, and Medicare, and they actually make money on private insurance. The problem is we have more and more people on government insurance and less on private health insurance due to Abomination Care. I also was on a Zoom meeting with 6 CEOs from hospitals a couple years ago, and they're all very tight financially here in the state of Minnesota. I think 2 are from the metro and 4 were out state, but they all said the same thing. Under medical assistance or Minnesota Care, they get about $1 of reimbursement for every $2 of expenses. Under Medicare, they get about $1.50 reimbursement for every $2 of expenses. So they lose money on government health care. Private insurance, they get about $2.50 for every $2 of expenses. So they actually make money. The problem is we're getting less and less private insurance and more government insurance. Under a single payer, they would actually reimburse doctors at hospitals lower than medical assistance on fee for service, according to my staff. So it will severely damage and restrict one of the best healthcare systems in the world here in Minnesota. But we do have a lot of dark clouds on the horizon, as I've been sharing here. Again, we can solve this problem. We can give seniors and people under 65 better access to the doctors and health care they need. But we have to reform this system. And giving an option to insurance clients that will give them that freedom is what I'm proposing up here at the state of Minnesota. God bless you. Thanks for listening. And please stay involved.